Good evening and welcome to our COVID-19 pandemic town hall. My name is Natalie Moser, council member Natalie Moser, and we are going to go ahead and get started in about 1 minute. So please take a moment and just take a seat, get a drink of water, and we'll start in just a few minutes. Okay, sure. Give another few seconds and we'll get going. All right, we're going to go ahead and get started. Again, welcome to our COVID-19 pandemic town hall with the city of Huntington Beach. We appreciate you being here. We also appreciate all of the folks who are here to assist us this evening in educating and engaging with our community. First, before we begin, I just wanted to take a moment to introduce the people on the team here and in virtual land, and that includes our fire chief, Scott Haverly, Oliver Chi, our city manager.
Hello.
And then on Zoom, we have Dr. Hari Keshava, who is the assistant clinical professor of surgery and thoracic surgery at UCI School of Medicine. And then finally, we also have Dr. Sarah Lopez, who is going to really be leading the bulk of tonight's presentation. I'm going to read briefly her bio. She was born and raised in Orange County, attended medical school at UCI, and business school at UCI's Paul Mirage School of Business. She was part of UCI's first program in medical education for the Latino community cohort, a program focused on training highly qualified doctors who are culturally competent and dedicated to serving the diverse population of Southern California. After medical school, she did her emergency medicine residency at LAC-USC, one of the nation's top EM training programs. She stayed there an extra year to start the first emergency medicine hospital administration fellowship, which continues to accept new fellows every year. Dr. Lopez's life took her on a brief stop in the Midwest, where she was faculty at Indiana University Medical Center, but soon returned to Orange County to work at Kaiser Permanente Orange County. And she is now the patient safety officer at Harbor-UCLA Medical Center, where she is also faculty in the Department of Emergency Medicine. Thank you both so much for being here. I really appreciate it. And then one other thing to note with Dr. Keshava is he's actually an HB resident as well. So first of all, today has been a very challenging day in our country. So challenging that, we could have considered actually, canceling or rescheduling this. But I think that part of what created the challenges today was COVID. So there's value in continuing moving forward and working to take care of our community to help slow the spread and really help be able to reunite our community and heal, which is both a physical and also a community healing. So with that, during these challenging times, we also want to make sure as a city that we are engaging the community. And so with that, we're going to have a series of, thank you. We're going to have a series of town halls coming up. And this is just the first of many community engagements and town hall events. We'll talk in a moment. There we go. Thank you. the many town hall events. And the first one after this is going to be coming up on January 20th from 7 to 8. Oliver, can you talk to that just a little bit?
Yeah, for sure. And as Natalie said, first, good evening. Welcome, everyone. Thank you for joining us today on in this discussion about COVID and some of the issues that are at hand. It goes without saying, COVID has created a lot of conflict in the country and here in Huntington Beach. And everyone has been and will have the opportunity to make their own decisions moving forward on how they want to respond to COVID. Are you going to get the vaccine? I think here at the city, our biggest concern moving ahead is that we make sure we get as much information out to the community and to the public as possible to help inform people's decisions. To that end, as Natalie mentioned, we've been working closely with the Orange County Healthcare Agency. The process of getting vaccines distributed throughout the country has been challenged. Certainly, if you've seen the news, things are going a little bit more slowly than all of us have hoped. In the next couple of months, that vaccination distribution process will ramp up. I currently serve on the Orange County Healthcare Authority's vaccination task force, and we're meeting regularly each week to work through the logistics of how we're going to get vaccines distributed. And to that end, starting this month, we'll be doing multiple town hall discussions every month moving ahead. So this is, as Natalie described, the first of many discussions we'll have the next few months. And over the course of the next few months, the vaccine will become much more widely available to anyone who does want it. The next meeting that we will be having in partnership with the healthcare agency here in Orange County is going to be on January 20th from 7 to 8 p.m. We'll have more details on that develop moving ahead. And then as you move forward in February, March, and April, we'll be doing additional town hall discussion series every first and third Wednesday of the month. And we'll make sure we get all of that information publicized here shortly as we move forward. Natalie, we'll turn it back to you.
Thank you. So just a little overview of the evening. We can back up. There we go. One more slide. Perfect. So an overview of the evening. Number one, we're going to be going over a presentation with Dr. Lopez, but within that, we'll have some conversations, some testimonials, and we'll culminate at the end with some Q&A. So you're welcome to add your questions to the Zoom if you're on that, or if you're on Facebook Live, we can go ahead and add them there. We will be moderating those and going through them. The presentation itself is relatively robust, so I don't imagine that we'll have a ton of time at the end for questions and answers. However, know that whether or not we answer the question this evening, we are looking to add those to FAQs, and also they will help shape our future conversations as well. So don't feel like you're not being listened to. You are. It just might not happen tonight that the answer comes to you. So with that as well, our goals of tonight's town hall discussion. We're going to be talking about what do we know about COVID-19 today, and also what is the impact on our healthcare system and the delivery of healthcare services. Also, we'll be discussing vaccine facts and distribution. And finally, how are we going to slow the spread of COVID-19 between now and when the vaccine is widely distributed? So from there, I am going to pass it over to, I think, our testimonials actually. So the first person we're going to hear from tonight is going to be Chief Haberly. And I've asked Chief Haberly just to mention, perhaps some things that would be of note to us. So take it away.
Thank you very much, Councilmember. And good evening, everyone. Thanks for being here tonight. So I wanted to talk a little bit, kind of a snapshot of Huntington and how it's affecting Huntington Beach currently. We normally run 4 ambulances that are 24 hours a day. So 4 of our ambulances will work on in a 24-hour rotation. And then we add 2 ambulances we call day cars that run 12 hours. So now we're up to 8 ambulances a day. We're running 8 24-hour ambulances today to handle the call load associated with COVID. We normally run anywhere from 50 to 60 calls per day that are emergency medical calls here in Huntington. However, right now, those calls, 50% of those calls are COVID related, meaning the symptoms that we're seeing in the field, either people are telling us I'm positive with COVID or they have symptoms related to COVID. How that's made it a little more challenging is that as the hospitals fill up in capacity, our ability to drop off patients in our local hospitals has slowed dramatically. In Huntington, normally, In our 4 closest hospitals, we average anywhere from 15 to 20 minutes, what we call patient offload time. That's the time that we show up to the back of the hospital. The nurse or doctor will come out and meet us. We'll do a patient transfer. There's some paperwork involved, and they move to a bed in the emergency room. Right now, our patient offload time is averaging greater than 60 minutes for every patient. We've seen as high as 3 hours and as long as 5 hours. In essence, kind of waiting in line to drop the patients off. And what that tells you, as the hospitals fill in capacity, as their ICUs fill in capacity, the emergency rooms aren't able to transport patients to the different floors in order to treat them. And so it ends up kind of slowing the system down. So in Huntington, one of the things we did by adding the additional ambulances, it gave us a little more capacity so that when we have those times that we're waiting, we can still respond on calls. Additionally, when you in Huntington, since the pandemic, really we've ran about 1,800 patients that we've taken to the hospital for COVID-related symptoms or COVID. However, 500 of those patients were in December alone. So to kind of give an idea of the recent surge, it's been very significant. Just the month of December, the after Thanksgiving surge that we talked about. And what we're starting to consistently see now is the patients that have been sick for a couple of weeks, they're starting to advance and have more significant symptoms that are respiratory symptoms that we have to treat in the field. In addition to that, what also is unusual for us that we've seen with COVID that's different than normal flu season that we've seen over the years is that we'll get a call to a household for someone who's sick. As we're treating the patient that's called, their spouse is sick as well. And then we end up treating the spouse and we transport both of them to the hospital. And so what's interesting with COVID is that in flu season, someone gets the flu and you might have one person in your house that's sick, but it tends to spread through the house quickly. And so when we get on scene, we're actually sometimes transporting more than one patient to the hospital. Maybe the patient that called us, we end up finding out that the spouse is actually has worse symptoms or is sick as well. And then we take two to the hospital. So for us, that's been kind of some of the trends we've been seeing. Additionally, we're also seeing patients that are COVID positive. And it's a difficult thing because when somebody gets a test, there's a lot of anxiety to find out that you have COVID. When you have colds or symptoms, there's anxiety associated with that. I think all of us think, if I have a sore throat right now, there's a sniffle, can I taste my coffee? And you start to kind of, give yourself a little bit of you kind of get worried and nervous about it. And we're also seeing patients that are tested positive, but they don't want to tell us. So we get on scene and they have symptoms and they're sick, and we'll say, have you been tested for COVID? No, and I haven't. And then in the back of the ambulance, they said, oh, well, I have. And so they feel some anxiety. And for us, we want to just relate to you that we're here to help. You've called us. Even though if you have COVID, we're not going to treat you any differently. We have our safety gear on. We know there's a lot of anxiety. And it's scary when you have that. However, we're here to help you out and treat you. And the more information you can give us, the better. And I think that's kind of some of the trends we're starting to see a little bit. With that, increasing the ambulance has allowed us to maintain our response level and to be able to call when you call 911 for someone to show up there. Our response times are remaining consistent, which is something that's very favorable to moving through that. As we move forward, I think a lot of things we want to communicate to everyone is that, one of the things that we're also noticing is that when you have somebody sick in your house or somebody's been diagnosed with COVID, the CDC has some great guidance docs, and we can put those on HB Ready of how to help them in your house to isolate them so that the rest of your family members aren't sick as well. Because we are seeing it move through households at different capacities, where some people are a little sicker than others. So that would be kind of a rundown of how we're seeing it.
And maybe what I would add too, Chief Happerly and I speak every single day, 7 days a week. On the weekends, our spouses yell at us because we're talking to each other more than we are to our spouses. And the very real situation that we're dealing with right now is that every piece of the overall healthcare system is completely strained right now because folks are becoming so sick with COVID. When the hospitals back up, the very real concern that we've had in Huntington Beach from a service delivery perspective is if we can't drop patients off from the hospital, the ambulances, we actually have been struggling internally with this very real possibility that if someone were to call 911 in Huntington Beach and require ambulance transport, we may not have an ambulance available. Now, we've created a 3-tiered response pattern plan to address those issues. We've moved into the second tier of that response plan, which is basically throw every piece of equipment we have out in the field to make sure that when the public calls, we can respond. The challenge is that as we move into the next couple of weeks, the healthcare system is already at max capacity. And the concern that fire chiefs have, that city managers have, that hospitals have, that doctors have, is that if we get an additional surge of cases, the healthcare system is so strained at this point. There's concern on how do we expand even more. And there's some radical things that are happening right now that in Scott's career as a paramedic and a fire chief, in my career working in cities, we've never even considered things that are being discussed now. Things as crazy as having paramedics and EMTs transported into a hospital to provide support to hospital staff and providing care. There's talk about rationing care right now because we don't have capacity in the medical care system to handle additional patients. That is the very real practical concern that we're all struggling with right now. That folks, when we built the system, that if you need help, our job is to be there, provide that support. Right now, again, everything is so stretched and so strained that the concern that all of us have again is when folks call, we're not going to be able to be there. And that's one of the very real issues we're dealing with.
Thank you. Thank you very much. And I think that kind of leads nicely into Dr. Kashava and his testimonial. Again, he's over at UCI. And I just asked him, I asked Dr. Kashava just to share a little bit, maybe a story or some words on what he's been seeing over at UCI.
Yeah, thank you very much for putting this on and for the city of Huntington Beach to put this on, because I think the information that we're all talking about now and Dr. Lopez is going to be talking about is crucial just to get what's out there. So I am at UC Irvine. I do thoracic surgery. I'm also the chief of thoracic surgery at the Long Beach VA, so I can also tell you what's going on there as well. So at UCI, as you've all probably heard, there is the mobile hospital that is now up. It's a tent hospital, essentially almost like one of those Army style tents that you've probably seen on videos of Army hospitals. And it's in the parking lot outside of UCI. Maybe some of you have parked there before, but that's a capacity, if I'm not mistaken, of about 40 patients, and it's full. It's up and running, it's full now. And we have about, if I'm not mistaken, almost 40% COVID positivity with close to 50% COVID positive ICU. Just like what the fire chief was talking about, this puts a whole strain on the whole system because if we have now an ICU capacity of almost close to 50% or 40% with COVID patients, then just our usual ICU care can't go to the ICU, and that backs it up into the ED or into other areas of the hospital and subsequently out to the community where patients are just not able to come in. I've had a couple of patients now that we are now having to not, or we're being told we're not able to do surgery. I do cancer surgery, especially lung cancer surgery, and I'm not able to do these potentially life-saving surgeries because we just don't have the capacity in the hospital. At the VA in Long Beach for our veterans, we can only do one ICU level surgery a day, which is huge. It puts a huge strain on the system, huge strain for our veterans. And we're seeing more and more cancer care being put off. And thus patients are presenting with later stage cancer. And in my case, potentially non-operable cancer at that point or metastatic disease. We've had actually a couple of patients where that has happened. So this is a huge strain. And I know everyone is asking these questions. What do we do about it? What do we do? I think just at an individual level, something as simple as like wearing a mask is huge because it has been shown to decrease the spread of COVID. And some of the myths that I hear is, oh, it decreases your oxygenation. I can tell you as a surgeon, if this decreased your oxygenation, you wouldn't want me operating on you. So that is just not true. It does not happen. It's okay to wear a mask. It's okay to be outside with the mask, run, walk, whatever you need to do. I wear this kind of all day in the operating room now all day just because it's the right thing to do. And I don't want to spread this to other patients or to other people and vice versa. If I see a COVID positive patient, I don't want to get it, potentially spread COVID to someone else. So I think just like what we're seeing, we are seeing this big strain in Orange County. I think someone was asking in the chat box about oxygen and oxygen rationing. I do know that the EMS patients or EMS providers are now having to put patients on oxygen only if their oxygenation is below 90%. I think Dr. Lopez and the fire chief might be able to attest to that a little bit better than me, but that's what I'm hearing. And this is something the EMTs usually practice. When you see a patient, you put them on oxygen right away. So this is now a change of our usual care that we're seeing, and patients that I see, of course, are going to need oxygen if I do lung surgery on them. So this is a deviant from our standard of care, which I'm hoping we don't have to keep doing, but it is something that is happening more and more and more. So again, thank you for the city of Huntington Beach for putting these on, and I'm happy to take questions at any time and to hopefully let everyone know that this is a big strain on the system, a big strain on cancer care, and a big strain on all of healthcare in Orange County and all of Southern California.
Thank you, Dr. Kashaba. I appreciate that. And we'll definitely have you help out with the question and answer at the end as well. From here, let's go ahead and bring it over to Dr. Lopez and let her take it away.
All right. Now, do you have the PowerPoint?
Yeah, we're going to pull it back up right now.
Okay. All right. Hello, everybody. So my name is Sarah Lopez, Dr. Sarah Lopez. I want to thank you so much for, really coming on and taking the time to listen to this talk and try to figure out really what's going on. One thing that I can say is, when you walk outside the street, it seems like everything is fine, right? Everything seems okay for the most part. We've gotten used to, this kind of, this pandemic. We've almost kind of normalized it a little bit. But when I walk into the hospital and when I walk in to see my colleagues, it's something completely different. And so that was really the impetus of this talk, because I want to talk about how bad is it really, right? I've had a lot of people tell me and ask me, hey doc, you're an ER doctor, how bad is it really? And what I want to show you here, and what Chief Haverly can attest to and was commenting, if you can see this first picture, these pictures here, this is right outside of my hospital. You could see all those ambulances parked there. And one thing that is very unique about this is that those ambulances are parked with the patients inside of their rigs, inside their ambulance, because there's no room inside the actual hospital, because the hospital itself, the hallways, the lobby is filled with patient care areas, and we just don't have any more beds and nurses and doctors to take care of more patients. And so patients are actually waiting in the ambulance in the parking lot, in this parking lot. And that's a huge problem, right? If you have a very sick patient, let's say you're in a car accident, because we're a trauma center, you're in a car accident and you come in, and where do we see you if there's no more room? Right? We've gotten to the point where we have seen people in the ambulance bay where they come in. And you can see these pictures of us basically intubating patients one after another, and the amount of protective equipment, personal protective equipment that we have to wear. Someone had asked a question that they've seen people wearing 2 masks, and you don't have to wear, that's not a recommendation for the rest of us to wear 2 masks. What you probably have seen is someone wearing an N95 respirator, which you could see here in these pictures. These doctors here are wearing N95s, and some of them will put a surgical mask or another mask over it to protect that N95, because we've had to reuse them, right? Because of the limited resources and because we're going through so much PPE, we've had to reuse our N95 respirators. And so you put a surgical mask over to protect it. But you going to the grocery store, going anywhere else, do not have to wear 2 masks. Now, this last picture I actually took of one of my patients who really wrote and said, I can't breathe, I will suffer. And that really struck me, right? Because because we're all suffering. And I feel like we're not understanding how tragic it really is for all the doctors, the nurses, the respiratory therapists, the paramedics, the fire department that's going in to basically try to help people and not having enough for everybody. Next. So I want to talk about the rates of infection here in Orange County. This, as you can see, I got it from OC Health information. It was updated yesterday at 9 a.m. And we basically have here in Orange County 170,000 cases roughly that have been confirmed. Yesterday, we had almost 9,000 cases, right? Yesterday we had 25 deaths. Or the day before, we had 25 deaths, and we've had almost close to 2,000 deaths in Orange County. And you can see the number of people that are starting to recover. What's really interesting and kind of frightening for me is that 1 of 19 people who are getting tested for COVID are coming back positive, right? And that's a huge number. And in comparison, LA County, 1 in 5 that are getting tested for COVID are coming back positive for COVID. And what does this mean? This basically means that there's this huge spike of patients and that are getting infected more and more. And with this new viral strain that's coming from the UK that is now here in California, what that is causing is that more people are getting infected quicker with this new strain, right? So this new strain is not necessarily making people sicker, but it's getting more people sick and infected quicker. And when you infect a larger number of people, just by the sheer number and volume, more and more people will die and will have chronic and severe consequences from this illness.
Let me
now,
let me
go
say
ahead.
here too. One of the questions that we had, and maybe Chief Haberly or Oliver can speak to this. In Orange County, have we seen this new strain of COVID yet?
So we have not seen the new strain in Orange County, but it's in San Bernardino. So really what that means is we haven't sequenced it yet, right? Because it was found in San Diego and it was found in San Bernardino. So the fact that, whether it's here in Orange County or in LA County, that's just a matter of time. And part of the other issue is during the Christmas and New Year's, that's when people are going to get infected. And that's when we probably are going to start seeing the strain. Does that make sense?
Yes.
So, and that's really what I want to talk. That's why we want to talk about. It's what can we do right now? Now that, this seems to be getting out of control. What can we do now? Next. And what can we do if we get infected, and how does this virus really work? And so I wanted to talk about the journey of a patient that ends up getting exposed to COVID. So you have someone that has, you're a susceptible person because either you were not wearing a mask or you were around someone that had COVID, you were eating, which is one of the, eating or drinking without not having a mask on, with someone that was either asymptomatic or pre-symptomatic, right? You get an exposure and it takes roughly between 2 to 12 days from when you got exposed to when you're actually starting to show symptoms of COVID, when you start feeling like you have something. It takes some time because what happens is the virus comes in and it starts replicating in your cells, and then your immune system takes a little bit of time before it can actually respond. And you feeling ill is your immune system responding to the virus. And that's why we say, if you feel that you had an exposure to COVID, you shouldn't get a COVID test right away because it could actually come back falsely negative. You should actually wait between 5 to 7 days after your exposure to get tested and get that COVID test. Then you start having symptoms and you can be infectious from any point from 10 to 30 days, right? Really what we talk about is when you last started having symptoms, you're 3 days after your last symptoms, you tend to be safe and can pretty much, be able to stop your isolation while still wearing a mask, right? And then after roughly, 10 to 30 days, you're no longer contagious. And if you've gotten through it and you're doing fine, then, that's wonderful. You have you're basically should be having antibodies and an immune response to subsequent infections, but some people end up having kind of chronic conditions and chronic symptoms or other issues. Next. And what are some of these symptoms that people experience? Well, the most common thing is fevers, right? So about 78% of people have fevers. They have cough, fatigue, feeling tired or not enough energy to do your normal activities, loss of smell. That's actually one of the most, was underreported initially, the loss of smell and taste. And the reason is that in our nose, there's these receptors, the ACE receptors, which is what the virus uses to get in. Adults have a lot of them in your nose. And so that's why a lot of people have a sense of loss of smell, because they have an overwhelming viral infection from the virus in their nose. You also have difficulty of breathing. About a quarter, 1/4, a fourth of people that get infected have difficulty breathing, chills, shivering, body aches, wheezing, headaches, sore throat, joint pains, confusion and dizziness. And then there are some patients who end up having GI symptoms like diarrhea. Next. Now, the difference between tests, let's say you got exposed, you've waited, you're starting to have some symptoms, you feel like it might be allergies, you feel like it might be COVID, you think it might be the flu, you're really unclear, you had an exposure, you've waited 5 to 7 days to get tested. Which one should you do? Well, the test that you should do is the PCR test, the diagnostic PCR test, which is very different from the antibody test, which is also being offered. The PCR test actually takes swab, and you basically want to make sure you get a good amount of swab, because you're trying to take that virus and you put that swab with that virus, with enough virus, hopefully into a PCR tube. And if there's any virus in there, it'll replicate and it'll turn positive. If there's even a little bit of virus, it'll turn positive. So you know that you have the viral infection. Now, the difference between that, meaning you have an active viral infection, versus the antibody test just tells you whether you've been exposed to the virus and you mounted an immune response. Because remember, once you're no longer contagious, you can actually have, you could still have antibodies. Now, but the thing is, with the antibody test, if you test too early, this test can also be falsely negative. Basically, your immune system hasn't mounted enough of a response to develop antibodies. So the key here is, if you have to choose the PCR test, the diagnostic PCR test, because that's really the one that will find whether you have COVID or not. And you should absolutely wait 5 to 7 days from your first exposure to even get tested, or when you start having symptoms. Okay, next. Now, let's say your test comes back positive, right? You're really shocked, you're really surprised. You thought this was probably allergies. You were a little worried in the back of your mind it might be COVID, and now it is, right? So what do you do? So little self-quarantine 101. So who should quarantine? Anyone who has been exposed to someone with COVID-19, or you have a positive test, right? Let's say you were exposed to someone, you weren't wearing a mask, they weren't wearing a mask, then you want to self-quarantine. Anyone who has been around groups of people without face coverings or physical distancing, you want to quarantine. And basically what that means is you want to wear a face mask if you're inside your house with other people. You want to wear a face mask whenever you're in communal areas like the kitchen, the bathroom, the living room, and you really want to stay inside your bedroom or in a separate space for roughly 10 to 12 days. That's really what we're recommending. And so some people say 2 weeks, but 10 to 12 days. You want to stay in your home or lodging. Stay away from other people, even in your own household. I think that's really important. People don't understand that. If you're quarantining, then you and the other people in your household should all be wearing face masks when you're in the same vicinity. Now, for how long? 10 days from the time of exposure or after travel, and continue to monitor your health for about 14 days, right? And it's within this quarantining time, if let's say you want to get out of the quarantine for whatever reason, you have to go back to work before the 10 days is up, then you can once again get that COVID test roughly 5 to 7 days after initiate first exposure to see if you're positive or not. And then why do you want to do this? Honestly, it's to avoid infecting others, right? To help healthcare workers like myself do our job, like Chief Haberly, right? Like all of us that are trying to do and take care of you guys, take care of our community, and to really slow the spread of COVID-19. I think that's really the most important thing. Next. Now, some of this slide, I find it to be really helpful because a lot of people, you know, trying to see like, well, what are my activities? What can and can't I do? So in the low risk index are things like staying home, getting takeout, walking outdoors, running, biking, picnicking outside, like doing outdoor things with your own bubble, with, you know, the people that are in your household. Low to medium is going to the grocery store. Right now, actually, this retail shopping is now much higher. It's in the medium to high range just because of the amount of COVID outbreak that there is. So we're not recommending retail shopping, but grocery shopping and playing outside is appropriate. Things that are medium, visiting hospitals, medical offices, dental appointments, using taxis. Now, outdoor restaurant dining is actually medium to medium high. And the reason for this is because with this potentially new strain, you actually don't have to, you can be farther away and still catch COVID. And so this is a really risky activity. A lot of us think, oh, well, I'm eating outside. But if you really see how close people are in proximity and they're talking, and if you can actually see the smoke of the cold air when you're talking and where it's floating around, you have an idea of how much, you know, how risky this activity really is. Then we have other things like, you know, large gatherings, traveling, going to concerts, going to, you know, religious services, indoors, going to bars. Those things are high risk. Next. Now, look, I want to take a little bit of time to give you a 101 on how we develop immunity, right? The vaccine basics. So how does one develop an immunity? Because we're going to talk about the vaccine. So here you have the coronavirus, and the coronavirus usually infects you. It basically gets in through your nose, it docks, and it binds to ACE receptors. You could see here on this image, the virus is an RNA virus. And it has these like spike proteins. People have been talking about the spike protein, and it docks on your ACE receptor, which we have a lot of them in our nose. And that's how it gets absorbed into the cell. And it actually, the virus is really smart. It uses your own cells and the apparatus of your own cells to replicate more of itself, right? So it's actually using you to replicate more complete coronavirus, and that's how it overwhelms your body. Your own body is making more and more of this virus, and it finally releases it here. If you could see in step 5, it releases the virus, and you end up having these antigen presenting cells, or these antibody, basically these immune response cells that absorb the virus, are trying to kill it, and they present little pieces of the virus so your body can make antibodies. And that's kind of how we make antibodies normally, naturally. Can you go to the next slide, please? So how does the vaccine work? Well, in a very similar way, I want to talk about that right now. We have vaccines that are virus vaccines, vaccines that are vector vaccines, vaccines that are RNA, DNA vaccines, and vaccines that are protein vaccines, right? So there's a variety of different vaccines, from your polio vaccine to your flu vaccine and everything in between. Now, how this particular COVID mRNA vaccine works is very much the way the virus works itself. We actually, the vaccine itself has no virus in it. Like it's not, it's pretty brilliant because we're not giving any patient any piece of the virus. What we are giving is a little piece of messenger mRNA. And basically what messenger mRNA is just instructions of how to make that spike protein, right? So and your own body will absorb it and make the spike protein, but it's not the whole virus, right? It's just that little viral spike protein. And when your immune system, right, picks it up, it only sees this little spike protein and says, all right, this is very weird. I'm going to, make antibodies to destroy it, and it basically destroys it. Well, what's interesting is when you actually get infected with the virus, the SARS-CoV-2 virus that causes COVID, when you get infected with it, you already have antibodies. So the virus doesn't even have enough time to get into your cells and start replicating, because the antibodies come in almost immediately and block it from getting in and attack it. And it's pretty brilliant. And that is why, people that have this vaccine don't get any symptoms, don't get COVID-19, because they have these preformed antibodies. Now, we have two types of vaccines right now. We have the Pfizer and we have the Moderna vaccine. Next. Now, this is me getting the vaccine 2 weeks ago. I have my booster coming up next Wednesday. And basically it's this vaccine, the Pfizer vaccine is a 2-dose vaccine that you basically need 2 doses of it to get your immune response to respond properly, so you have long-term immunity. And I've had a lot of people ask me, Dr. Lopez, should I take it? Can I trust it? But it's happened so quickly. And I want to say that that mRNA vaccines, Moderna actually has been studying mRNA vaccines for 8 to 10 years almost. So this is something that we've been studying, scientists have been studying for a really long time. So it's not something that they just came up. But really what happened is in January, the SARS-CoV-2 virus got sequenced completely. So all its RNA got sequenced. And that's when really the science community came together and started developing and looking at what kind of proteins on this virus would work to develop a vaccine. And that's how they found the spike protein. And that's how basically Moderna and Pfizer came out with a vaccine that allows for almost 95 to 98% immunity, right? And protection, which is really good. And one of the things I'm going to share with you is that before, when I was taking care of patients back in March, April, I got diagnosed with breast cancer. And so I had to go through 6 months of chemo. And I spoke with my oncologist afterwards, and we discussed me getting this vaccine. And we realized, this vaccine is very safe because you're just getting mRNA. You're not actually getting any antigen or any virus. So it was safe for me, right? So can you click? So any side effects, the only side effect that I had was that my arm was a little sore in the injection site. The next morning it felt a little sore. Otherwise, I've been feeling pretty great, right? And I'm getting my second shot on Wednesday. Now I'm going to show a video. Oh, it's telling me I can't share.
I think we can share it over here.
Okay.
Video to work? Yes. All right. We can do it here.
Okay, so I'm going to show a really quick video of me getting the vaccine.
You can share it actually, Sarah. Sorry.
Share it? Okay.
Yeah.
So this is me getting the vaccine. It was actually, I want to describe a little bit of the scene. It was very festive. It was actually one of the very first times that we were festive and celebrating and you can hear the music in the background and you can hear laughter, because this is really one of the first times that we felt like we can pivot and we can, change the direction of this terrible pandemic. So, can you hear me? All right.
Yes.
So that was me basically getting the vaccine at Harbor-UCLA. Actually didn't hurt at all. And like I said, it was a very momentous time to be able to, to be able to get this. Can we pull up the PowerPoint again? Oh, let me stop sharing.
There you go. Thank you. I'll get back.
If we scroll down.
I think it's the other screen. Just 1 second.
Sure.
There we go.
All right. So why are we taking this vaccine, right? I think that's really the important question. Why are we doing this? And I want to talk about herd immunity. Let's see here. I want to talk about herd immunity because I think this term has been thrown around a lot. And I want us to understand what that really means. So when we have no vaccination, if only a few people get vaccinated or none of us get vaccinated, if someone in the group has COVID-19, as you can see here in the yellow, and you see the blues are people that either got vaccinated or have already recovered from COVID-19, you could see that the whole room can almost get infected with COVID-19, right? And develop symptoms. In contrast, if we have enough people that are vaccinated, right? As you can see here in this other graph on this other side, on the right side of your screen, you could see that one person has COVID-19, but because so many people in that group are vaccinated, really only one, maybe two get infected, but that's pretty much it. The rest of the other people that are either immune compromised or too sick for whatever reason, haven't been able to get the vaccine, because they get protected because the rest of us have been vaccinated, right? Then the disease can't spread very fast. And so the whole community stays safe. And that's really what we're talking about, is how do we get our community safe? Because how do we reopen back our businesses and get our economy back going? How do we get to that point where we can, spend time with each other without having to fear and having to stay away and socially distance? Can you go to the next slide? And the reason this is important is that, I found this graph very fascinating because without a vaccine, it would take us roughly 59 months to get to herd immunity, because people are talking about herd immunity. Well, it will take us 59 months. So in 2025, we will finally reach herd immunity, right? Where we can with many, many deaths. But if you think about by taking the vaccine, if 25 people of the population agree to get vaccinated, it will take 30 months. If 50% of the population agrees to get vaccinated, it will take 10 months to get herd immunity. But if 65% of the population is vaccinated by June, then we've reached herd immunity, because what we're talking about, between 70% of people, if 65 to 70% of people are vaccinated and have immunity, then we have reached herd immunity and protection for the community.
Really, we don't really know exact percentages that we need to get to herd immunity right now. And as Dr. Fauci said, we need to probably all have a little bit of humility and think through, is it 60%, 70%, 80%? Ultimately, we need to have the vaccine widely distributed across the population for this to be considered, for us to be able to get back to some semblance of our life pre-COVID.
And I agree with that. And I think that's something, thank you for bringing that up. And that's something that's really important. Part of the reason this is so important is that, Dr. Fauci and a lot of people in the science community said something at the very beginning. We got more information and we said 65%. We got more information and we realized, actually it's 80%, because we are getting constant information. And that's the beautiful part for me about science, right? that you have certain information that comes in, and as more and more knowledge and studies and research comes in, you change your recommendation. So I agree with you. Right now, people are saying 65. It might be 80%. We don't know, and that's how. But it's basically we're moving forward, knowing that this is the right direction, right? To get vaccinated, for all of us as a community to be vaccinated. Next slide, please. Now, how can you get vaccinated? What is the rollout? So really the first phase is healthcare personnel and long-term care residents, right? Those residents that are living in skilled nursing facilities and healthcare professionals, either in these skilled nursing facilities, home health nurses, or those working in hospitals. Then we also have our paramedics, our frontline staff, right? Our paramedics, our police.
And for us in Orange County, the distribution protocols will look a little bit different than what you see on this chart. That's been part of the challenge, I think, in the vaccine rollout. And everyone's heard that it's been a little bit slow, that we haven't gotten as many vaccines distributed as we want. And that's part of what the next couple of months we'll spend time sharing with the public. When can the vaccine get widely distributed? Typically in past mass vaccination protocols, the federal government has provided a lot more guidelines as it relates to who does get the vaccine and who doesn't. One of the challenges that different counties and different states are facing right now is there's been very little oversight from the federal government in terms of what the protocols are. And so if you watch the news, you may see in Florida, right now you can drive up, and if you're over a certain age, you get vaccinated. In California, there's different rules between different counties because the state of California has implemented different protocols compared with Florida. And then to make it even more confusing, different healthcare agencies are able to go ahead and reprioritize based on specific needs within those counties. And so there's the difference between LA County and Orange County. You will see differences between counties, between states on how everything is rolled out. The basic information right now is in Orange County for the next couple of months, the general public we don't have enough doses of the vaccine to provide the general public and anyone who wants it to get it. But we have a operational plan in Orange County we're currently working on. The goal in Orange County is by the 4th of July, every person in Orange County who would like to get a vaccine will be able to have been vaccinated by the 4th of July. In our county, we're calling it Operation Independence. And again, in the next, it'll take another month or two before widespread information is finalized. There's still a lot of discussions happening as it relates to prioritization in Orange County, who gets the vaccine when, and all of those details will be rolled out here in the coming months.
And I would like to add something to this. It doesn't matter which vaccine you get, whether it's the Moderna or the Pfizer one, whichever one you're offered first, that's the one you should be getting, because on the data out there, there's actually very minimal, if not no difference between the two. So I would actually get whichever vaccine that you're able to get first. So once in Orange County, once we're able to roll it out and you're one of the people that gets called and it's your time, it doesn't matter if it's Moderna or Pfizer, just get it.
There's a question on teachers getting this. Do you mind commenting about the rollout for teachers? Because I feel like they're, from what I understand, they're part of the essential frontline workers that would be getting it sooner than later.
Yeah, so in Orange County, teachers are right now prioritized. Our tiering structure is different than what you're seeing on this slide here. Teachers are included in the next distribution phase. In Orange County right now, that means likely in February is when that rollout will occur. For the rest of January, we're trying to get through the initial phase of vaccinations for us here in Orange County. That'd be healthcare professionals and frontline care workers, nursing home residents, and congregate care facilities also have access. That rollout we're going to stay in our current phase in Orange County through the end of January. We don't have exact dates though, and that's part of the challenge. There's meetings happening every week in Orange County with the task force that's trying to get this all streamlined and facilitated. That's the task force that I serve on. Chief Haverly is actually part of a vaccine distribution plan where the fire authorities here in Orange County will be coordinating the vaccination distribution with the county. So it's a little bit long-winded. The bottom line is for teachers, likely not till February. We'll know more in the next 2 weeks when that next distribution phase will happen. And you better believe there'll be a lot of media coverage and news coverage moving ahead once we get to that phase.
Yeah. And one of the things that I wanted to address, there, someone had commented and questioned about, you know, if they have severe allergic reactions, what options do they have? And one of the things that I wanted to say is that a vast majority of people that have had severe allergic reactions have taken this vaccine, and really there haven't been severe reactions. And what ends up happening, one of the things that you didn't get to see in the video, is that after you get the treatment of the vaccine, you don't actually just get sent away. You wait for about 15 minutes to see how you respond. And there's usually treatment, but you know, to this date, there hasn't been reports of, you know, significant amount of people having severe allergic reactions to this. And these are people that have had, you know, penicillin allergies, sulfa allergies. They tend to do perfectly fine with both the Moderna and the Pfizer.
Dr. Lopez,
I'd like to add to that, what Dr. Lopez was saying. I was a person that grew up with allergies, had to take allergy shots myself. When I got my vaccine, just like Dr. Lopez said, I had a little bit of some pain and some irritation around the injection site, but otherwise I had no issues. I was fortunate enough, I didn't even get any fevers, myalgias or anything. I went for a run later that day. I think 5 days later, I was doing some push-ups, and so I wouldn't be too afraid from that standpoint, even with allergies.
Let's hear from Chief Haverly too. Thank you, Dr. Kashaba.
And how we're kind of running our initial pod or point of dispensing, or where we're applying the vaccine or administering the vaccine to frontline workers, is that after you've checked in and gone through the questionnaire process and you receive the shot, you wait in a holding area that you check into. So you check in with someone, they write down the time, you wait in the holding area, you're observed by medical personnel, and then after 20 minutes, we check in with you again and then take your name down, and then you're allowed to leave after that. So we kind of watch anybody after they've gotten their shot. And to this time, we haven't had any reactions that we've noted in the frontline workers that we've vaccinated.
All right. Next. All right. So what can you do right now? Right. So, you know, wearing a mask, that is wearing a face covering is the best thing that we can do right now. And wearing a face covering that covers both the nose and the mouth is really the best thing that we can do. Because really, you know, if the person is not part of your bubble, someone that you live with, you know, when I go and see my sisters, when I go see my parents, we are wearing masks because we don't live in the same household. And now it's become something that's very normalized because we want to protect each other, not knowing whether we might become, you know, we might be asymptomatic now and then develop symptoms later on for whatever exposure, because we're still, you know, working, we're still going to the grocery store. And so we want to protect each other. So wearing a mask is really important. Next.
Dr. Lopez, one of the questions that we get now is that if after they've been vaccinated, you still need to wear a mask. And so we're continuing to tell people that you wear the mask, and kind of until you hear something different. It's usually after your second dose, the efficacy is the best, and then it's 7 to 10 days after that. And so a lot of people feel after their first dose, they don't need to wear a mask anymore, and that just isn't true. You still need to wear it. You still can be a carrier, asymptomatic carrier during that kind of 30 to 40 day period of your inoculation. And so we just continue to recommend that. And a lot of people ask, oh, I don't have to wear a mask anymore, but we still recommend you wear them.
Absolutely. So I completely agree that you still have to wear a mask. And to tell you the truth, I have my children. I don't know if there was a slide before this or if it was taken out. So my children still, they wear a mask, right? Because my children are not getting, you know, vaccinated anytime soon because they they'll probably be at the end of the rollout. And so I have, I still recommend, I still wear a mask, even though I'm vaccinated, right? I've had one vaccine and I'm getting my second one soon. I'm still wearing a mask. Now, some really quick COVID tips. If you're getting to work or buy groceries, do not remove your face covering when near others. One of the things that I've noticed is that people try to lift the mask a bit so they can talk or move it. And that's really the time you want to keep that mask on. Avoid eating or drinking with anyone outside of your household, right? If you're going to eat with anyone outside of your household, it should be out in the open, in a park where you have separate blankets, distanced, right? And really you want to try to do it distanced together, but distanced. Taking takeout, I highly recommend getting takeout and taking it out into an open space. If you are going to take off your mask, wash or sanitize your hands every hour if you can, right? Especially when you come from outside, coming into your home, that's really the point where you really want to wash your hands. Take a break from shopping right now. If you don't have to go to Target, there's been outbreaks at Target, at Costco. If you don't have to go shopping, if you can somehow get a delivery service, if you're able to do that, then, opt for that, but try to minimize how much you're exposing going into shopping areas. Don't go to any gatherings with people outside of your household. And I know that's really tough. I know that was really tough during the holidays. And as we're coming into January and February, I think it's really important, to be considerate and think about the people in your household and whether you'll bring something in and whether you'll, I see, friends, you want to hug friends and you want to be around friends. And I think it's really important, but wearing face masks, being outside, trying to have social distance, I think those are really the key things. And then exercise by yourself or only with those in your household. I think that's really important, right? Because when you're breathing very heavily, right? And especially if you're not using a mask, that can become a problem. All right. And I believe that's it.
Perfect.
Sure, there's questions.
Thank you so much, Dr. Lopez. That was very helpful. And now, yes, we're going to take a look at the questions. And we're going to start with, I had received some originally with our Zoom registration. So I'm going to go through a couple of them. I know a lot of them I think have already been taken care of during the course of your presentation. So let me just take a moment. And actually, before we start to answer them, I will say that a number of the questions that came in before were about enforcement and mandates. And, that's really not what our conversation is about tonight. But certainly continue to provide us or send us those questions, and we will find the right platform and time to respond to them, and perhaps respond with FAQs on our city site, our city website as well. As far as we talked about the method, do we have any idea what the main method of transmission is in Orange County?
I think in discussing that, we look at, a lot of times we look at how many people are infected, and right now with a 7-day lag, we're at 67 per every 100,000. So for every 100,000 of population in Orange County, 67 people have COVID. That's on a 7-day lag. If you run the 4-day lag, the numbers we run, it's greater than 100. And I think when you talk about how it's transmitted, it's really that it's prevalent in the community when you go into the grocery store, when you're at, like the doctor spoke of, when you're going in those high-risk areas, there's a very significant chance you're going to be walking by or working or talking with somebody who's infected. That's why we highly recommend wearing the face covering and social distancing. But really the transmission is that it's just moving through the community. At 100 people for every 100,000 is significant. And what's happening too is we saw a little bit of a plateau, very, very slight one in the last 3 or 4 days. However, we haven't hit that Christmas surge yet. But the positivity rate is climbing. So we're plateauing, but our positivity rate is going higher, which tells us it's just moving through the community at a much more rapid rate.
I think the things that, we need to highlight is that people are getting it at work when you're with your colleagues and you're in that break room and you take off your mask to eat with them. That's how it's happening as well. You don't realize because, they're your friends, they're your colleagues, or, you're together, they don't have any symptoms yet. And that's really where a lot of us, seem to be falling, or where we're getting it, where people are getting it.
I think just to add to what's challenging is at the rates that Chief Haberly mentioned, 100 people out of every 100,000 in population does have COVID. When it's that widespread, that means 1 out of every 100 people has COVID in Orange County right now. So if you go to the supermarket, you just have to assume there's going to be a handful of people in the supermarket that do have COVID at that particular point in time. And when it's that widespread, the challenge you have is all of your contact tracing protocols are basically useless. It's basically so widespread. There's no real good way to track where everything is happening. So the best thing to do in the instance that we're currently in with all of the surge that we currently have, and the impact on our medical resources, the best things to do are basically regulate your risk. Try to do things that are less risky. And the slide that Dr. Lopez had on low risk versus medium risk versus high risk activities. I think everyone has a different risk tolerance level. And I think we just would urge folks, please, to try to engage in lower risk activities when possible. And if you do feel like you need to do things that are a little riskier, take all the precautions that you can. Wear a face covering, wash your hands, try to stay 6 feet apart from other folks. There's ways to still live your life, but still be safe. And I think that's something we really want to encourage moving forward.
Thank you. A question that we received was about aerosol. So it says, I think more attention needs to be paid to aerosol transmission, particles less than 10 microns that float in the air for hours and can accumulate indoors. It says cloth masks help some, but not much in those cases. Outdoors with a slight breeze, the risk is much lower. I know that this person sent me some aerosol information. Do you have any feedback on that, both Chief Haberly and also doctors?
So I can talk about that for a second. So I've done some research on this actually in the past with the aerosolization. And yes, of course, cloth masks, gaiters are not as good as a surgical mask. That being said, if you don't have a surgical mask, can't afford it, or it's easier to use a cloth mask, you can wash it, then use a cloth mask. We've seen the data is there that actually does help. Yes, maybe a surgical mask is better, but a cloth mask does help. And those situations, whether it be low risk or high risk, if you're wearing a mask, you're less likely to have the aerosolization of these particles, regardless if it's a cloth mask or a surgical mask. So you're less likely to transmit it to someone else, and of course, less likely to get it yourself. So that's the reason why we recommend these cloth coverings or a surgical mask coverings if you're able to get one of those as well.
Thank you.
So Dr. Kashava, is on point with this. If you're wearing a mask, the particles get trapped within the mask itself, and then the other person is wearing a mask, right? So that's the whole point of both people wearing a mask. And really, this is something that we've discussed quite a bit when we're working in the hospital, and that's exactly why we wear an N95, the N95 respirator when we're working in the hospital, because we know it does get aerosolized when we're intubating patients, and to protect ourselves and our staff, that's exactly what we do. But in terms of just in the walking around in the community, I think aerosolization of the particles is less of a concern, and just being able to wear the mask to protect from the saliva particles, right, from respiratory droplets is really important.
Have anything to add, Chief?
I would think also it's just rethinking what our room capacities are. And a lot of times we're comfortable, like you said, in a break room. And normally we sit 8 or 10 people in there to have lunch. But with COVID, maybe you should only have 2 or 3 people in there. And one thing at the city hall, all our rooms are posted with COVID occupant loads. And they're occupant loads that are calculated to make sure that the social distancing takes place and that there's not more people in the room than should be. And I think we have to kind of rethink how comfortable we are with how many people in a room that we normally operate, and that really will help out a lot.
Absolutely. Thank you. One of the other questions here, and I'll just paraphrase it, but that there seemed to be a disproportionate effect or impact on minority communities. Do you have any, is there any evidence as far as why that's happening? Is it anything that has to do with their makeup, disease?
No.
Social lifestyle?
Yes, so this is something we've taken a look at because disproportionately Latino communities and Black communities have been affected by the COVID-19, by the SARS-CoV virus, COVID-19 disproportionately, and they're dying disproportionately. And some of the main things, it's not genetics, it's not that their DNA is made up differently, it's specifically access, right? So they tend to be more essential workers, people that cannot work from home. So those communities get impacted. There also access to healthcare is much more limited. And then also their ability to socially distance themselves. They usually have, multi-generational families living in close proximity. And so if one person gets infected, all of a sudden that whole household, right? The grandmother, the kids, the parents get infected within that community. And so that's part of the problem, right? It's understanding how this virus spreads and how quickly within a household it can spread and how it can affect a whole community. And then it affects, the building if you're not aware of how it's spreading. So it really has to do with, them being essential workers and having to go to work and not being able to work remotely from home, access to healthcare, right? Limited resources. And then in the fact that they live in close proximity and aren't able to socially distance is a big factor.
Thank you. This one's for Chief Haberly. Do paramedics who interact with potential patients with coronavirus get tested for the virus? And what happens if a paramedic tests positive?
So we do. So we wear a tremendous amount of PPE. We're N95s when we interact with patients, gowns, eye protection. We have a pretty rigorous policy on how we do that to protect our paramedics because they're inside living rooms of patients with COVID every day. If our paramedics do get tested, however, if they have symptoms or they have an exposure, meaning that if they're exposure, if they don't have their mask on or something happens, their mask gets dislodged on a call, things on emergency situations do happen. Then we have a protocol program in place where they're sent home for quarantine, they're tested and monitored for those 5 days as we watch. Sometimes we'll do what's called a SOFIA test or a rapid test quickly just to ascertain if they have it. We'll follow it up with a PCR in a few days. And then they'll stay home in quarantine away from other staff until those tests come back negative and then bring them back to work. We have had some of our paramedics and some of our lifeguards and our ambulance attendants have tested positive. But our internal protocols have kept it from moving through the department as rapidly as it has in some areas. However, we are very careful and secure about maintaining quarantine anytime somebody's exposed.
Just to expand on that a little bit, the work at the city, in addition to the fire department and the police department, public works operation, and really all throughout all the other city departmental operations, we've installed fairly rigorous safety protocols and also contact tracing protocols. So what the chief just described happening in the fire department, that same type of process happens across all the departments if there ever is an exposure incident. And we've been fairly fortunate since the start of COVID. We haven't had any spread within our employee population based on contacts within the work setting. Typically what we're seeing is as COVID spreads in the community, folks get COVID and the symptoms and getting sick part and contracting it happens outside the work setting.
Let's see. I think we've answered part of this one. Has Orange County seen the oxygen shortages reported in LA? But the second half of this question is, have you needed to issue directives to the paramedics to not transport patients that are deemed unlikely to survive?
No, so we're different than LA. So as far as oxygen goes, in LA, they changed the SpO2 or the pulse ox to 90% below. We're still 95% in Orange County. And then the directive of what people refer to maybe as do not resuscitate or transport isn't. So what we do is we if somebody's in cardiac arrest in Orange County, we work the patient for 20 minutes at the scene. Then we make base station contact and then consult with the physician, decide whether or not we're going to pronounce it at the house or transport. And that's the normal protocol that we would do. And that hasn't changed in Orange County. Now in LA County, it has changed based on their situation and their oxygen rationing has changed. But at Orange, we're at 95% pulse ox, which is a normal protocol for us.
But things that, you know, if you do have a pulse ox at home, you know, one of the things is that a lot of right now the hospitals for admission, you have to be less than 90% of the pulse ox for admission. So that's, you know, that's separate from what the paramedics are doing.
Thank you. Let's see. So I think this is an opinion here. Do you think it's safe for schools to have kids go back to in-person learning? I'm going to throw that to Dr. Lopez. And just as a parent, I would say that it's up to the schools and the school districts to kind of make these decisions. And in our case, certainly not the city, but just as your opinion goes.
Yeah, I think this is really tricky. Now kids do get COVID, do get the infection. They just don't have severe symptoms, right? So for them, it's like they have a cold, which is the good thing, that they don't have severe symptoms. But the problem is that these kids then infect other kids that go home or infect the teachers, right? So you're infecting, you know, the teachers, the custodial worker, or the cafeteria workers, right? And this, you know, these kids can then pass it along to themselves, and then those kids take it home to their parents and get their parents sick. So that's really the problem, right? How do we do it where we can have these kids basically maintain social distancing, wearing the masks, right? And limiting the number of kids in a room, right? How do we do that safely? And that's really, if schools can do that safely, then it's safe. And doing that safely is what's become really tricky, right? Having a plan and a strategy to do that becomes really hard. And I think really it becomes to each parent, like, what is your risk assessment, right? For me, because I had cancer and I was going through chemo, I decided to put my children in what we call Cloud Campus, which is a remote learning school for the whole year, knowing that this was going to take some time. Now, other parents have different opinions in terms of their risk, right? And their risk assessment. And I think, you know, it's a really difficult situation that these schools have. But, you know, the important thing is kids do get COVID, they do get infected, they do pass it along to their parents if they do get infected, and it's assessing that risk.
I would like to add something to this because of some of the people that I have done research with in the public health community that do specifically like school age research. They've actually seen something that's very interesting, is that kids are actually very good about wearing their masks in the schoolyard setting, in the school setting. So around the country, whether it be like New York or other states, they've seen that kids are very good about wearing the masks. So just like what Dr. Lopez was saying, you kind of have to take your individual risk assessment involved, but we do know that kids are very good about wearing masks, and that's a very good thing to see that with our young children.
I think the only thing I'd add is by far, without question, the United States has had the worst response in the world to COVID-19. And it's just without question, when you look at the statistics, there's no country that has performed worse than us. Our schools have remained closed. You look at some of the other models that have happened in Europe and other countries that have prioritized keeping schools open, but moderating other crowded gathering locations. Their infection rates haven't been as high as ours. And I think with the research we've seen, again, everyone does have to make their own decisions. If it's important enough, there are safety protocols you can install to get schools back opening. There's, I think, you know, legitimate reasons on both sides of the argument why that doesn't happen. But I think if you look at the models across the country and the performance between countries, other countries have performed much better than us, and they've still had their schools open. So, you know, ultimately, again, there's a lot of different reasons why we haven't opened schools here in the U.S., and that's something that the next couple of months, the state and the feds have prioritized as part of the next round of funding. The governor is really trying to prioritize getting schools open. That's why teacher vaccinations are being prioritized here in the near future.
Which is really wonderful.
Mm-hmm. And as a reminder, we will only be taking questions for the next 10 minutes or so until 7:30. So do please continue to add your questions. If we're not able to answer them tonight, again, we will add them to an FAQ. Another question that we had was how successful have COVID-19 plasma donations been for helping infected patients?
So convalescent plasma, which is basically plasma from someone that got infected with COVID and now has antibodies. So that is being used, and it's being used sporadically in different facilities depending on resources. It was under investigation, I think a few months ago, it was, really under investigation. You had to be part of a study. And for us at Harbor, we are, it's basically part of a study to be able to use the convalescent plasma. At other places, there's specific protocols, and it's shown to, benefit some patients that are pretty critical that need, a boost in help. But that's one of a variety of different tools that are being used to tackle COVID-19, because there's not one drug that really has changed anything, and that's why vaccination is really our path forward.
Great. Let's see. I am not seeing a lot more questions. Let me just see if I have any other ones that we haven't already gone over. I think we're moving through them actually. Does anybody else have anything to add or to share for this before we close it out?
I think the one thing that we would encourage at the city is stay informed. The next couple of months, there's going to be a lot of information coming out about vaccinations. The current state of the country is very divided. There's a lot of opinions and beliefs about the vaccine and about COVID. Ultimately, we're not going to try to preach and tell folks what they should or shouldn't believe, but I really would encourage folks, arm yourself with the best information you can. And please know that public health professionals, everyone is doing their best to try to keep people safe and keep people alive as we work through this COVID situation. Did you know, on average, the folks that have died from COVID, on average, have lost almost 14 years of their life? When you look at that, it's not just old people dying. When you look at the spectrum, it's impacting everyone. And the biggest issue we have right now is the number of folks that are getting infected. It really is overrunning and straining our healthcare system to the point where if we have another surge from New Year's and Christmas, everyone is looking at each other saying, what do we do? The system will break. That's not the situation we want to be in. So the next couple of months, there will be a lot of information coming out, a lot of news coming out. Vaccines will become more readily available. And I'll just want to note for folks in Huntington Beach and in Orange County, as we move through January, moving ahead, every 2 weeks, the city will be working with the healthcare agency to get additional town hall discussions put out, where we'll keep getting more information distributed. We just encourage you to stay plugged in as we move ahead and stay safe. And let's try to be kind to each other moving ahead, because this has been an incredibly stressful year for everybody.
Before I say thank you to everyone, a couple housekeeping items. We just wanted to let you know that this presentation will be made available on hbready.com by tomorrow morning. Some people have asked about the slides being available, and I'll follow up with that and see if that's possible. Another thing is, if you do have additional questions or might have some even moving forward about this, you can send your questions via email to media, MEDIA, at searchcity-hb.org. And again, we will either respond to you directly or add those to our FAQs. And so, as we close out tonight, I just wanted to, number one, thank our speakers, thank our staff, thank all the support team that helped make this possible. The fact that you were able to, give of your time in this very trying time, when I know you have so much going on in your hospitals and within our city, it's very appreciated. I think that this has been a mutual sacrifice, but I think that certainly our frontline workers have experienced a heavy burden and a heavy lift with regards to that. So thank you. Two, I believe that we're going to be working on a Spanish version of this presentation. Dr. Lopez has offered to do that. So we haven't 100% figured out the date and time yet, but we will be letting you know about that as well. So that way we can make sure to engage all of our community. And then, the final piece here is, I think that our goal as a community is to keep each other safe, to be able to hug each other again. I want to be able to see my parents in their home and not outside. So I want our businesses to be able to open, our people to be able to go to church and worship. So how do we do that? Really it's following the science, following the evidence, doing our best. This is hard, we're tired. But if we all do our best and work together, I think that there is true hope on the horizon. I am very optimistic that, even though we've gone through so much suffering and challenge, and we will probably continue to do so over the next couple of months, if we look at this Operation Independence, and by July 4th, have everybody that wants to be vaccinated, there is a real opportunity for the second half of this year to be just so much more hopeful than it's been over this last period of time. And so I hope that this has been helpful. Please do continue to engage with us so our information is not just flowing down, but flowing back and forth. And I do look forward to the additional incoming town halls that we're going to be having. And again, thank you so much to our speakers and for everybody that helped support this and joined us tonight. Thank you.
Thank you.
Thank you very much.